November the 17th, 2017, 11:35 a.m. EST. If you ever want to see a perfect totem to the most obscene limits of government apathy, ask the nearest Albertan to show it to you. They will proceed to gingerly withdraw a shapeless rag of battered wood fibers from their wallet. If the object still retains any legible text, it will read Alberta Personal Health Card and all. The Albertan comes from a magical place of bountiful wealth, technical acumen and government largesse. And yet, one of their most critical government documents, a document they are expected to carry at all times, remains stubbornly rooted in the Apollo era. Despite its alleged status as a card, the Alberta Personal Health Card is not even printed on cardstock. Rather, it arrives as a piece of regular paper emblazoned with the quixotic plea to please protect your card. If the card owner manages to secure a lamination machine, they'll find that the finished product doesn't fit in their wallet. If they slip the card inside a protective sleeve, they'll find that friction quickly causes the ink to be lifted off. Left to its own devices, the card can be reduced to the consistency of toilet paper within a matter of months. Nurses and hospital administrators report routinely being handed mulch by patients. Some exasperated residents have taken to simply carrying a post-it note emblazoned with the health numbers of themselves and their children. A signed health card also serves as the only documentation that an Albertan has opted to become an organ donor. Paper, it should be noted, is normally bad at legibly surviving the types of events that typically cause people to become organ donors. And it's been this way since 1969. The current design, a two-tone design personalized with a dot matrix printer, has been untouched since the early 1990s. This is probably a good place to mention that the Alberta health system is uniquely susceptible to healthcare fraud, as is Canadian hospital that finds itself accepting one of these health cards. Anybody with access to a rudimentary printer can rig up a forgery and instantly be accessing thousands of dollars in care. As early as 1998, provincial reports were warning that border communities were swimming in many more cards than their populations, indicating a likely black market of Americans coming over the Montana border to cheat Alberta healthcare. In 2004, Alberta's Auditor General estimated that card-related healthcare fraud could be costing the province up to $80 million per year. The cards never expire and they decompose so readily that they are reissued without a second thought. At the time, a single family was found to have been issued nearly 1,000 cards. All told, the number of cards issued was more than 3 times the Alberta population. Warnings came again in 2015. You can almost look at the healthcare insurance card as a credit card without a spending limit, Alberta Auditor General Merwan Sahir said at the time. It would be wrong to assume that plastic cards are somehow unfamiliar to Alberta. The Alberta driver's license is a modern marvel of holography, microprinting and laser engraved barcodes.